Not quite sure of the role of radiotherapy, but we know that the main treatment should be hormones. What we then need to consider is whether or not we treat the prostate itself with radiotherapy in addition to the hormones, and that is less certain.
I was reading, in fact I have it here, I read an article by Dr. Thomas Stutterford from the Sunday Times, I think it is, and it's something that he talks about Dr. Heather Payne of the Middlesex Hospital, and talking about hormone therapy and radiotherapy, and she says that she doesn't believe in just one method of treatment. She believes in a sort of belt and braces approach, that we should use everything that we've got at our disposal.
Well, generally, I agree with her, but I think that newspaper is taking a very general approach. In my practice, when I'm treating earlier prostate cancers than yours with radiotherapy, I always use 3 to 5 months of hormone therapy beforehand to increase the effectiveness of the treatment. But that's a slightly different situation than the very specific situation you found yourself in.
Right.
So generally I agree.
Right.
But in your case, we know that the hormone's the important thing, but we are uncertain of how important the radiotherapy is.
Right, and presumably she means that she could mean too that she ends up with exactly the same sort of result as you do, that she would start somebody and then add radiotherapy. It doesn't necessarily mean that she would start both together and do everything at once, does it?
I think